Good morning, Kennedy Jr. I am Mahira. Let's start the warm-up sessions. Do you think doctors should attend continuous education?
Absolutely. Continuous education is vital for doctors to keep up with the latest medical advancements. It ensures that we can provide the best care possible to our patients. Whether it's attending conferences, workshops, or online courses, ongoing learning allows us to expand our knowledge, learn new techniques, and stay informed about emerging treatments. It's a crucial investment in both our professional development and the quality of patient care.
Tell me a quality that you possess that suits your profession.
One quality that I possess that suits my profession as a doctor is empathy. Empathy allows me to connect with my patients on a deeper level, understanding their concerns, fears, and needs. It enables me to provide compassionate care and support, which is essential in building trust and rapport with my patients. By putting myself in their shoes, I can better address their medical issues while considering their emotional well-being. Overall, empathy enhances the patient-doctor relationship and improves the quality of care I deliver.
Do you believe there is gender disparity in your profession?
Yes, gender disparity exists in the medical profession, although it has been improving. Women are still underrepresented in leadership roles, face challenges in achieving equal pay, and encounter gender biases in certain specialties. Efforts such as mentorship programs and diversity initiatives are crucial in fostering a more inclusive and equitable environment in medicine. By addressing gender disparities, we can create a profession that better reflects the diverse talents and contributions of all healthcare professionals.
What do you find rewarding about being a doctor?
One of the most rewarding aspects of being a doctor is the opportunity to make a meaningful difference in people's lives every day. Whether it's helping a patient overcome a health challenge, providing comfort and support during difficult times, or simply being there to listen and empathize, the ability to positively impact someone's well-being is incredibly fulfilling. Additionally, the continuous learning and intellectual stimulation inherent in medicine keep me engaged and passionate about my work. Ultimately, knowing that I have the privilege to contribute to the health and happiness of others brings immense satisfaction and purpose to my role as a doctor.
How do you deal with someone who isn't satisfied with your patient care?
When a patient isn't satisfied with my care, I listen attentively to their concerns and validate their experience. I address their specific issues transparently and offer alternative solutions if possible. Open and respectful communication is key throughout the process to foster trust and understanding. My goal is to ensure the patient feels heard and valued, working together to find a satisfactory resolution.
Your preparation time is over. You can now start the role play.
Good morning, Mihira. I'm Dr. Kennedy Jr. How are you today?
Good morning, Dr. Kennedy. I'm a bit overwhelmed, to be honest, but I'm here to get some guidance.
I understand. We're here for a follow-up after Liam's asthma diagnosis a couple of days ago. Can you tell me how he's been since his visit to the emergency department?
His asthma hasn't been too bad. He's had one attack since then, but we used the inhaler and spacer from the hospital, and it seemed to help his symptoms.
That's good to hear. Let's get some more details. Is there any family history of asthma, eczema, or hay fever?
No one in our family has asthma or eczema, but I usually get mild hay fever in the summer.
Thank you for that information. What could be the potential triggers for your child's asthma attacks? Are there certain things such as exposure to cigarette smoke, dust mites, or pollen that seem to bring on your child's asthma symptoms?
No one smokes at home, and we try to keep the house really clean. Do you think his attacks are triggered after he's been running around outside?
That's great to hear, Mihira, that you're taking such good care of your home environment. It's true that a clean home can significantly reduce the risk of asthma triggers. Let me brief you about asthma for a better understanding. Asthma is a chronic lung condition that can cause the airways to tighten or narrow, making it difficult to breathe. It can also involve swelling and extra mucus production in the lungs. While the exact cause is unknown, factors like a family history of allergies like hay fever can increase the risk. It's quite possible that outdoor allergens like pollen or even cold air could be triggering your child's asthma after playtime. Physical activity can also sometimes trigger symptoms. Do you have any concerns?
The diagnosis was really overwhelming. I'm not sure how to help him manage it properly.
I completely understand how overwhelming a new asthma diagnosis can be. Mihira, it's natural to feel unsure about how to manage it at first. The good news is that asthma is very manageable with the right approach. Many children with asthma lead full and active lives. Regular monitoring, identifying and controlling triggers, and knowing how to respond in urgent situations are key to effective management. Mihira, we can work together to create a personalized asthma management plan. This includes assessing the severity of your child's symptoms, identifying potential triggers, and learning how to use his medication correctly. It's also important to inform his school about his asthma so they can provide the necessary support. Remember, you're not alone in this.
That sounds reassuring. I feel a bit more confident about managing his asthma now.
I'm glad to hear that. Mihira, let's talk about the next steps to ensure Liam gets the best care. First, we'll conduct a thorough examination of Liam to see how he's doing right now. This will help us understand his current condition better. Next, we'll create a personalized asthma action plan for Liam. This plan will include identifying his specific triggers, knowing how to manage his symptoms daily, and what to do in case of an asthma attack. We'll also discuss his treatment options in detail, including the proper use of his inhaler and any other medications he might need. It's important to ensure you and Liam both feel comfortable with this. Additionally, we'll organize ongoing support and schedule regular follow-up appointments to monitor his progress and adjust the treatment plan as needed. We can also connect you with resources and support groups for parents of children with asthma. Mihira, to start, I'd like to bring him into the room now for a thorough examination. This will help us see how he's doing and address any immediate concerns. Would you be willing to bring Liam in for his examination?
Yes, I'll just go and get him. Thank you, Dr. Kennedy.
You're welcome, Mihira. We'll take good care of Liam.